Hello, everyone. My name is VERONICA SCHIARITI. It's a pleasure to join the 6th International ICF Conference organized by Taiwan. The title of my presentation is Pediatric ICF-based Tools in a Changing World. It's always a pleasure to collaborate with colleagues in Taiwan. So let's get started. I am joining you from the west coast of Canada in the province of British Columbia. You are seeing a picture of the university campus on Vancouver Island. I have no conflicts of interest to disclose. I am a member of the American Academy of Cerebral Palsy and Developmental Medicine. I recently joined the board of directors. I am a founding member of the Latin America Academy of Child Development and Disability, and my role is to connect the Latin American colleagues to the rest of the academies in the world and to facilitate access to knowledge and based on evidence-based and ICF projects. I am also a consultant for UNICEF in Latin America. We're working on creating care pathways guided by the ICF for children with developmental disabilities aged 0 to 6. And as you might know, I was the leader of the development of the ICF Core Sets for children and youth with cerebral palsy. Taiwan was part of that project as well, and these are open access tools. The objectives of this presentation is to review applications of ICF-based tools in pediatric context, to introduce and update applications of the ICF Core Set for CP. There are some news related to that, and to update on new ICF-based tools for children with autism and some global initiatives related to the ICF in pediatric context. So let's try to cover objective number 1. You are quite familiar with the model, but I usually start my presentations reviewing the model and highlighting why it's so important having this conference and keep learning about the ICF. You know that the key concept is functioning, and this is a result of a dynamic interaction between body structures and body functions, activities and participations, which are domains so important in pediatrics. And that functioning relates with the dynamic interactions, again, with contextual factors, in this case, environmental factors and personal factors. We're living a pandemic, a global pandemic, and environmental factors have changed so much, and they impact a lot in daily functioning. So we need to be aware of that. Another important thing is that the ICF incorporates concepts and principles that are highlighted in the UN Convention of the Rights of People with Disabilities and the Convention on the Rights of the Child. So just to highlight some of the concepts that are really linked to the ICF, the human rights of boys and girls with or without disabilities. We know that children have the right to access information, and in this era of a pandemic, it is very important. They have the right to express their opinions, to access health services. They have the right to education, to recreation, that means playing, and to social inclusion. Again, because of COVID-19, there have been different situations where the rights of children with disabilities have not been exercised. And early on in the pandemic, I published this editorial in the Developmental Medicine and Child Neurology, and the title was The Human Rights of Children with Disabilities During Health Emergencies, the Challenge of COVID-19. And this was a call for paying attention and advocate for children's rights during a pandemic. The editorial have been very important and the message very important around the world. And the editorial has been translated into 7 different languages, including traditional Chinese. And so I invite you to check the content. But working with the ICF, for me, it's been very important to really learn how to advocate for rights, even in situations that are beyond our clinical practice or our research projects. Another key role of the ICF is as a communication tool, and this is more important every day. How we communicate, how do we really emphasize the opinions of children with disabilities and their families, and how we use a universal languages between the entire team and the families. What is the challenge? I think like the audience is very familiar with this, the manual or the length of the categories and the complexity of using the content of the ICF in daily practice it's a big challenge. So we need ICF-based tools to facilitate this. And this takes us to objective number 2, and to talk about the ICF Core Sets and an update, because I think you know the beginning of the ICF Core Sets and the process. Why we needed and why we took on developing the ICF Core Sets for cerebral palsy. We knew that we wanted to use the ICF model. We wanted to really embrace the biopsychosocial model, but still it was a struggle to apply that in clinical practice and in research. So that's why we thought it was crucial. As you know, there are many classification systems for CP, but not a universal language. So we took this project in 2008, and it took us 5 years to really get it completed, and we published this in 2014. You can access the publication. We created 5 different core sets and 1 comprehensive and 4 brief core sets, and people have been using them since the publication. Important messages is that the ICF Core Sets are very useful for tracking and following the developmental trajectories of children with cerebral palsy. This was missing until we published this, and so we're quite proud that we can follow all the trajectory of these children. And of course, they can be used in different settings, and again, the context is very important. And so this can be used at home, at school, and in the community. Since the publications, there have been different ways of applying the ICF Core Sets, and I am just showing one from a Latin American country. They created an intake form, and they have one section, the top section, dedicated to the perspective of the child. So they ask key questions about what is important for them, and then the bottom part of the form has the core sets, the categories of the ICF Core Sets. This has been instrumental to facilitate family-centered care in different rehab centers. There has been many examples of the implementation of the ICF Core Sets in different countries, and we published some examples in 2018. So I'm gonna talk about some of those. So the paper summarizes the experience in different countries, in Brazil, in Russia, in Malawi, and in Poland. Overall, based on the reporting of data and feedback from professionals from those countries, the most user-friendly and feasible core set was the Common Brief ICF Core Sets. And that was not a surprise because this is like 25, this is the shortest version, the 25 ICF categories, and representing all the components of the ICF. But I think people need a brief tool to apply that in clinical practice. They use it with multiple applications as a guiding framework, as a communication tool, as I mentioned before, as a functional classification tool, and I'm gonna show you an example, and as a method of comparing health and functional information. So if you see the application of the ICF courses are exactly the same as the proposed application of the entire classification. So this is an example from Russia. What they did was they identify evaluation tools to really apply and evaluate the areas of the ICF core sets. Once they did that and they have like a national consensus process, they created, they built a profile of functioning of children with cerebral palsy. And you are seeing different profiles of functioning based on the GMFCS classification. On the left is like the 0 to 1, 2, 3. And on the right, the 4 and 5. So you'll see more compromise of or restrictions in activity and participation as the kids have a greater impact in body function. So this is an example of Poland, and there's a huge rehab center in the area of Zamość in Poland. And what they did is like try to compare the services and the structure of the entire rehab center, and they map that to the ICF. And it was really a nice exercise to see that they were covering all the components of the ICF, and they were really working together and having an excellent teamwork and creating individualized, integrated rehab, education, and social interventions. So this was really like a quality improvement process that they did and figured out if there were some gaps in services and what they can improve. Overall, the impact on outcomes, clinical practice, and policy making, there was a positive change in disability approach. Once you start learning about the ICF, you start changing your belief and your attitudes towards disability. And that was across these countries. The approach changed from impaired base to a functional base. There was a really an emphasis on participation as main outcome in goal setting, and inform social policies and promote equality in different countries. So the outcome number 3, we're going to spend more time on this one. Then there's many things to talk about new tools or new initiatives guided by the ICF. One of the studies that this was a collaboration with a group in Sweden. As you might know, there are different ICF courses for different conditions like cerebral palsy, autism, and attention deficit disorder and hyperactivity. We were challenged at that time about the specificity of the content of the ICF courses for childhood onset disabilities. I think at that time, it was around 2018, that people thought that there would be a lot of overlap and we didn't need different tools for pediatric conditions. So we took on this study to compare the content of the core sets, of all the core sets existing for childhood onset disabilities. And we show that the tools have unique functional information, as well as unique role of environmental factors influencing functioning and disability. This is one of the figures included in the paper. The paper is open access, so you can also read the entire paper. So what we are showing here is the content, the number of categories representing the different ICF components. As you see, B, body functions, D, activity and participation, E, environmental factors, and S, body structures. And you'll see how these ICF core sets differ in terms of representation of the ICF components. Most of the ICF core sets represent activity and participation and environmental factors. So that's really great to see that, like a huge representation of those components. But you can see in different colors that the role of environmental factors is different in each one of the ICF components. So the content of each one differ based on the categorical or diagnostic criteria. Another one of the tools that this was published in this year, 2021, and this was an initiative in Argentina, in Latin America. What they did is try to create a cultural sensitive tool based on the ICF core sets for autism. You might know that the ICF core sets for autism, the ones that have been published and created by the group in Sweden, they are quite lengthy as well. The comprehensive ICF core set has almost 111 categories, which still is a challenge in clinical practice. So I'm showing, again, the paper is open access, so you can go and check the entire paper. But this group did a multi-step methodology, and what they tried to do is try to identify which are the most relevant categories for a Latin American context. So they did an item reduction, and they then process and would identify tools, measures that can really measure the categories included in this new ICF-based tool. They call it TEA or TEA-CIFunciona, and TEA is the abbreviation of autism in Latin America. So it was a new tool with a new name, and they created a checklist that contains 32 ICF categories, which is very, very useful in clinical practice. They are doing, they completed at that time a pilot in 100 patients, and I think I have a picture of that. Again, what you're seeing here is a profile of functioning of children with autism in Argentina. This is the first time that you have an illustration of the profile of functioning of children with autism in Latin America. And on the left, you have the children 0 to 6, and on the right, 6 to 16. And one of the key messages that they highlight is the role of environmental factors and how they can really identify which are the barriers that the kids have for participating and for communicating better. So on the right, you might identify the first category is communication tools. And for the group 6 to 16, it was a barrier. So it's important that based on the barriers that you identify, you can plan interventions, and they are working on that. Global initiatives, and again, I want to bring back the context of COVID-19. I think that we have been working on this abilities-oriented approach guided by the ICF, and again, across the lifespan. And it's nice to see that in this conference, you're gonna talk about this lifespan approach, And you are seeing one example of an accessible care pregnancy clinic in Ontario, Canada, which I'm really proud that, that Canada has such a program, and it's a very successful clinic here. We need to work, once you work on ICF and projects like this, you need to build connections. And in this changing world, because of COVID-19, we've been very connected with experts and colleagues around the world. So I'm going to show you some examples. Again, one project is linked to the other, and I think for me, the ICF brought me to my abilities first. And this is another paper that was published last year, and hopefully you can access. It's a short paper that has animations explaining what My Abilities First is. It's an initiative using ICF-based concepts and rights-based approach. And there has been multiple campaigns using My Abilities First. It's important because what we are asking is to change attitudes and to really ask the children and young adults to describe themselves. And we want to celebrate abilities first and not only limitations. And so last year in June, the European Academy of Childhood Disability organized a campaign using My Abilities First, and we have beautiful videos from around the world participating in the campaign. Then the Mexican Academy of Cerebral Palsy replicated the campaign, and recently the Latin America Academy of Child Development and Disability just finished the campaign. And if you're interested, you can access some of the videos. They are all open access and they're available in YouTube. Of course, I want to mention that there's a My Abilities First team in Taiwan, and I always celebrate achievements in Taiwan because you are quite organized and you're an example for the rest of the world in ICF-based data and projects related to the ICF. So the ICF-based team, or the My Abilities First, they did some cultural adaptations and some activities encouraging children and families to take this approach, describing themselves and creating like an abilities identification card. So if you are an individual with a disability, you might want to create your identification card so people will know you using exactly your words or what you want or you decide them to know about you. This is a really nice way to complement the information that we usually collect in healthcare systems or in education, that unfortunately is really based on limitations or negative language. So the group in Taiwan, they organized a workshop. They did educational sessions, and they already had collaborations and support from the Department of Education, some government agencies, and the School of Physical Therapy. So again, an example of a successful take on a project. What are the secrets of a successful partnership? Like, we are all collaborating with different groups around the world. I think we need to have a common goal and hope to achieve a positive change in things that we want, a successful change. Lessons learned, this is ongoing, is key to involve children, youth, and their families. This project has been implemented in different countries, and we're learning as we go. Like, the children have more suggestions, and we're learning as you see the kids, will create their own identification card, and most of them want an electronic one because they are like experts on technology. We need support and local networks, and they are essential to take on new projects. Advocacy for rights, and I think in the context, again, of a pandemic, it is crucial. The communities, I think, are ready for a change. So we need to really use this moment to achieve this change. Again, in the context of COVID-19, we have been very, very busy. I was invited to be part of the COVID-19 task force. It was organized by the International Alliance of Academies of Childhood Disability. And you might know that, again, we use the frameworks, the ICF and the human rights, the UN Conventions on the Rights of a Child as frameworks. And the task force organized 3 working subgroups. And I was the leader of the Global COVID-19 Childhood Disability Data Coordination. We're still working on the final report, and hopefully, we can share the results with all of you soon. There were 3 different subgroups, one dedicated to surveys, that was the one that I was leading. Then one group dedicated to resources, and they were trying to identify resources that will help families transition the COVID-19 pandemic, some help about remote support, and successful ideas. And I'm proud to say that one of the successful ideas that was identified was My Abilities First. Then the third group was listening and sharing subgroups. And what they organized was a series of webinars and trying to share information with the rest of the world. And last year, the global event on CP, World CP Day, they were part of that session as well. And I know that Taiwan was part of the global event in 2021. One of the papers that was published in February, and I published this with Professor Robin McWilliam, that you in Taiwan, you are very familiar with the routine-based model that he has created. And this paper was a perspective paper, and again, an open access paper, describing that innovative strategies, and we were promoting collaborative, empathic teleintervention for children with disabilities during the pandemic. And it was a mix of using the principles of the routine-based model in combination with My Abilities First. One of the projects that I managed to accomplish during the pandemic was the publication of this book, Early Child Development from Measurement to Optimal Functioning and Evidence-Based Policy. And this started as a special issue, and then due to the impact of the special issue, I was invited to organize this as an electronic ebook. And so you can access, again, an open access ebook that was published 2 months ago. And I always highlight that the organization of the content was based on the ICF and, again, human rights. And the content represents all continents. You might see there are 16 chapters, and we have groups from around the world, and colleagues from WHO, colleagues from the World Bank contributed to this book. So I like to invite you. There are colleagues from Taiwan as well as co-author or leading authors of some of the papers. Okay, we're wrapping up. There were many to evaluate the impact. I think it's there have been many initiatives and projects, and it's always essential, the knowledge translation conferences like this, to keep sharing the message. You might know that there's an ICF educational e-tool or a web page with clinical studies that you can go and teach your students or your trainees, or like refresh your knowledge about the ICF based on real case scenarios. And you'll see the kids here, Ethan, Lola, Megan, Lucas, and Matthew. And there are many papers that I can share with you. But I think we keep learning and we keep growing about, how to make this knowledge accessible and rapid for implementation. Again, one of the initiatives has been based on education and active education. This is an example of an ICF e-course in a pediatric context that I created this material in 2016, and it's been growing again, as I've been mentioning, until I think up to 2 months ago, there were more than 1,200 participants from 14 countries that had taken the course. And these are some of the satisfaction, or like the survey that we take after the course. The majority of people recommend the e-course to their colleagues and trainees, and people feel that they are ready for implementation after using the e-course, which is really a really nice thing to see. There are challenges in pediatric context. There are no universal access to ICF education. So I think that if people don't know about how to use it, they are not going to use it. And so I think that we need to keep pushing and showing that it's very important to have formal education and related to how to adopt and use the ICF. Currently, learning about the ICF depends on the interest of the professionals. There is no top-down mandate to invest in ICF education. And I hope that conferences like this will make a change, and people will hear that we really need a structure, a formal structure of education. There is still no clear understanding of the benefits of adopting the ICF in organizations, services, or health and education systems. So I feel that I have a very important role of keep pushing this agenda of making the ICF, or the access to ICF concepts, available to all. So in summary, the implications for everyday practice, there are many, but I just want to highlight some. It is crucial to know the diagnosis. So still we need to work on early diagnosis in pediatric context. The commitment of the structure, of the impact of body structures and body functions is important. So we need to be experts on that. It doesn't mean that we need to leave all the knowledge that we have. We just need to complement this with a functioning-based approach. And I think that's what the families and the children are telling us. The ICF and ICF-based tools like the Core Sets are useful to understand all the factors that interact to achieve the optimal functioning of the child. After all, daily functioning is what families and children value the most. And we have done many qualitative studies showing this. So we have evidence to support this statement. I mentioned different references. Most of them are open access. And if you don't find that, you can check on ResearchGate. I have I think I have posted most of the papers there, or you can contact me and I can share more information with you. Once again, thank you very much for the opportunity to share this information with you. And I congratulate you for keep learning and participating in this event. Thanks a lot.